Hello. Today, Alexandra, Theresa, Jenna, and I will discuss fetal alcohol spectrum disorders, why this topic is important to counseling, its impact on minority populations, and an appraisal of current research and interventions. I will begin by describing the issue. Fetal alcohol spectrum disorders, also known as FASD, are a group of conditions that can occur in a person who is exposed to alcohol during their mother's pregnancy. FAS, fetal alcohol syndrome, is the most well known. But FASD refers to a broad diagnosis that encompasses patients with FAS and other disorders. I will talk more about these other disorders in just a moment, but please know that the term FASD and FAS will both be used during this presentation. Exposure to alcohol before birth can harm the development of tissues and organs and cause permanent brain damage in the developing fetus, which can lead to physical problems, problems with behavior, and problems with learning. Some of the specific symptoms of FASD are low body weight, poor coordination, hyperactivity, difficulty with attention, poor memory, difficulty in school, especially with math, learning disabilities, speech and language delays, intellectual disability or low IQ, and poor reasoning and judgment skills. These symptoms affect children, of course, but without proper intervention, they can become lifelong problems into adulthood. The cause is very simple. FASDs are caused by pregnant women drinking alcohol during their pregnancy. To prevent a child from having FASD, therefore, a pregnant woman should not drink alcohol at any time. It's never safe. It's especially important during the first 4 to 6 weeks of pregnancy when a woman may not know that she's pregnant at that time. The alcohol enters the mother's bloodstream and reaches the developing fetus via the placenta. Alcohol causes higher blood alcohol concentrations in the developing baby than in the mother because a baby metabolizes alcohol much more slowly. Alcohol interferes with oxygen and nutrition for the developing baby, which can cause the symptoms that I just mentioned. In addition to the symptoms, there are other concerns surrounding FASD, including the prevalence of maternal alcohol use and the number of children affected by FASD. Maternal alcohol use during pregnancy is prevalent, with research showing that as many as 12% of pregnant women consume alcohol. And on the child side, FASD is estimated to impact up to 1 in 20 school-age children in the United States. Correct diagnosis and treatment is another FASD concern because people with FASD are often misdiagnosed because the use of alcohol by the mother is not captured in their prenatal record. The biggest concerns, of course, are the lasting effects. People who fall on the more impacted end of the disability spectrum may struggle to acquire the skills for successful independence in adulthood. If early intervention does not happen, people with FASD are more at risk for secondary conditions, including mental health difficulties like anxiety and depression, disrupted academic or vocational achievement, substance abuse, inappropriate sexual behaviors, and problems with parenting. As I mentioned earlier, FASD encompasses a group of conditions. 4 specific disorders fall under that FASD umbrella. Fetal alcohol syndrome, FAS, represents the most involved end of the spectrum. People with FAS have central nervous system problems, minor facial feature problems, and growth problems. ARND is alcohol-related neurodevelopmental disorder. People with ARND might have intellectual disabilities and problems with behavior and learning. ARBD is alcohol-related birth defects. People with ARBD might have problems with their heart, their kidneys, their bones, or with their hearing. NDPAE is neurobehavioral disorder associated with prenatal alcohol exposure. A child or youth with NDPAE will have problems with thinking and memory, behavior problems, and day-to-day living. Now, Alexandra will now discuss the importance of FAS to counseling.
Fetal alcohol syndrome is important to the field of counseling because it is estimated that between 800 to 8,000 babies are born with FAS every year in the United States. Individuals with FAS experience cognitive, social, and adaptive deficits that impact their functioning and overall well-being. It is difficult to diagnose as the symptomology varies. Additionally, the likelihood of comorbidity is high. Preventative counseling is the most preferred treatment. However, for the sake of this presentation, we will focus on counseling for individuals with fetal alcohol syndrome disorders. While FAS is difficult to diagnose, it has been discovered that early intervention is the most beneficial. Interventions that seek to alleviate primary deficits and provide family support may yield to the most positive outcomes. Additionally, early identification of functional deficits and strengths among children with FASD could guide clinical assessment and further intervention. Cognitive-based therapies are not the most effective for individuals with FASD due to impairments related to cognitive and adaptive functioning. Current research indicates that individuals with FASD respond well to approaches such as modeling, coaching, teaching, and skill building. The need for caregiving support is evident as well. Numerous studies reveal high rates of disruptive behaviors in young children with FASD, such as impulsivity and hyperactivity. This can result in internal depletion within caregivers. Therefore, interventions that support and equip them is imperative. Stress reduction includes promoting parental self-efficacy, exploring effective parenting strategies, as well as fostering positive parent-child relationships. It is likely that mental health professionals will come across clients that have FASD. In order to support clients with FASD, it is important to understand the nuanced symptomology of this disorder. Additionally, it is encouraged that counselors seek training for FASD and collaborate with FASD experts. The CDC offers courses and resources regarding FASD. Individuals with FASD and their families will benefit from counselors acquiring further knowledge and providing support.
A review of 10 studies from the USA, Canada, and Alaska reported a substantially increased prevalence of FASD among American Indians and Canadian Aboriginal people, and suggests that ethnicity is a key permissive factor for the creation of a biological milieu, within which alcohol develops its major effects. A recent meta-analysis estimated the global prevalence of FASD in the general population of children and youths ages 0 to 16 to be 7.7 per 1,000. In some countries or regions, its burden is disproportionately borne by Native or Aboriginal peoples. For example, among Canadian Aboriginal people, prevalence of FASD is 86.8 per 1,000, compared with 5.3 per 1,000 in the general population. This is significant. An Australian study reported that 65% of diagnosed FASD cases are born to mothers identifying as Aboriginal or Torres Strait Islander, showing a prevalence of 194.4 per 1,000 people. While numbers are lower in the US, between 2000 and 2002, 32 Alaska Native infants were identified with FASD compared to 6 non-Native infants with FASD per 10,000 live births. Our research indicated that a majority of FASD studies focus on Native and Aboriginal minorities when researching FASD among minority groups. There was, however, a 1986 US study by Sokol referenced in Finder and Feldman's book on adolescents' use of alcohol that found that being of Black race compared with white is an associated risk factor for susceptibility to the effects of prenatal alcohol exposure and the development of FAS. It seems there is need for further study among a broader spectrum of minorities in America. High numbers of FASD among Native and Aboriginal children is, as we've already stated, linked directly to alcohol use during pregnancy. Studies have shown that the prevalence of alcohol use during pregnancy in Alaska Native, American Indians, and Aboriginal women were found to be approximately 3 to 4 times higher than that of the general population. Even more alarming is that approximately 20% of these women in the US and Canada who consume alcohol during pregnancy engage in binge drinking, compared to 3% in the general population in both countries. Ethnicity is associated with specific drinking patterns and dietary habits that exacerbate or attenuate the toxic effect of alcohol. Specific groups can also have a higher susceptibility to alcohol-induced cellular changes, which in turn augment alcohol's toxic effects. The contributing factors to FASD among these minority populations are multifaceted. The historical and social context of Aboriginal communities, along with the intergenerational impacts of colonial history, including trauma, residential school experiences, and economic and social marginalization, contribute to alcohol use in these communities. The high prevalence of alcohol consumption and FASD among these populations must be understood within the intergenerational and the socio-demographic realities with which they live. Alcohol abuse during pregnancy is a complex issue that has had a devastating impact on Native and Aboriginal minorities in particular.
Increased awareness of fetal alcohol syndrome disorders has led to more research, and therefore it's also led to more effective approaches to treatment. And it's not just the alcohol. People with FASD are often exposed to other harmful factors throughout their lives, such as abuse, poverty, unstable families, and in general, just a rocky home life. In fact, children with FASD are very much overrepresented in the foster care system, with most reports saying that it's at least 10 to 15 times more so than children who are not affected with FASD. So there are several interventions, which Ali mentioned, and they focus on primary deficits, or the cognitive, the emotional, and the behavioral impacts of FASD, but they also focused on environmental factors such as the family and just the overall family structure. And so first of all, identifying FASD can be very tricky. It is a spectrum, so not everyone presents in the same way. They don't all have the same symptoms or even the same severity of symptoms. So it can be hard to pinpoint exactly when someone has FASD. So different healthcare systems have put in place different education systems to hopefully bolster providers' confidence in diagnosing FASD and noticing it quicker. Also, it can be very difficult to get an honest answer from a parent who was drinking during pregnancy. Oftentimes there's such a stigma with that they don't want to admit to drinking during pregnancy, which contributes to the challenge of identifying FASD. So like I said, there are initiatives in the medical field to raise awareness of how to identify it, with training healthcare workers to tactfully ask about prenatal habits, which with the intention to decrease defensiveness among parents who may have consumed alcohol during pregnancy. And all of this is with the goal of early identification of FASD, because the earlier it's identified, the more likely it is that the individual with FASD can establish healthy behavioral, emotional, and familial patterns. So some of the family and school interventions that have been put in place through various forms of research, a lot of it focuses on the parents of the children with FASD, because they do face some very specific parenting challenges. And if the parents respond negatively to some of these challenges, it can lead to very negative outcomes for the child with FASD. For example, insecure attachment, depressive symptoms, and disruptive behavior patterns throughout their lives. So parent and family counseling is very much recommended for individuals and families affected with FASD. It's the focus being to teach parents effective strategies to reduce their stress levels so that they're not imparting some of that stress on their children, to increase their self-efficacy in parenting, and to build a stronger, more positive parent-child relationship so that they can be there and be more supportive for their children who have FASD, and really for all their children, but especially the FASD affected children. So there was a specific program that was put forward by researchers called the Families Moving Forward program, or FMF, and it's really effective. It focuses on the larger family system as a whole and connects them to resources in the community. It's a manualized program, which means that counselors can follow a step-by-step outline of treatment. So any counselor can do it. It's pretty accessible, and there's lots of room for customization as needed based on the needs of the family and the individual, and the community as well, depending on what resources are available in the given community. So people with FASD, as Kim mentioned, they often have trouble at school due to their cognitive and behavioral and oftentimes the emotional and self-regulation deficits. This can lead to those students dropping out of school or being suspended, which just further exacerbates the societal impacts and the impact later in life of having FASD if it's not caught early on. But researchers have found that by modifying teaching methods and classroom environments in some fairly subtle ways, teachers can help students with FASD learn with fewer disruptions to hopefully lower the suspension rate and the dropout rate. So some of these interventions there was cognitive control therapy, which was intended to help students concentrate and be more self-aware. And then there was language and literacy training, which was intended to help students with letter and word recognition and just general phonics, just understanding phonics and how to recognize words. And that one proved to be fairly effective. There was self-regulation training, which was neurocognitive rehab meant to bolster executive functioning. So to help with some of that impulsivity. Mathematics training was a cooperative effort between parents and teachers in math instruction, and that showed really positive results. Working memory strategies was intended to help students recall abilities over lengths of time, so just to help their memory a little bit. And then the children's friendship training was an interesting one. It was a group counseling setting with parents and kids that were meant to help them learn social skills in a group. And the safety skills intervention was a computer game that researchers developed because they found that was more interactive, and it let the kids with FASD practice what to do in potentially hazardous situations, such as a house fire or crossing streets. And it let them practice that in a safe environment while still reinforcing the lesson. So in conclusion, FASD is definitely a multifaceted and generational issue. So mothers are affected, kids are affected, society in general is affected. So it's a very far-reaching issue. Our group agreed that to improve the situation and to reduce the instances of reduce the prevalence of FASD, the stigma around drinking during pregnancy must be removed. If pregnant women and new mothers feel comfortable being honest about their drinking habits, appropriate diagnoses and treatments are more likely to occur. And that feeds into the early identification. We also believe that legislation to support school funding for kids with FASD is paramount for improvement, because a lot of the Indigenous communities that Theresa was talking about, the school funding is quite low. So there's not enough money for some of those interventions to be put in place. And the prevalence of FASD and its overarching cause is so great that it's not going away anytime soon. And the research on behavioral interventions, it's really lacking. There wasn't a whole lot to go on. So most of the studies that have been conducted had really small sample sizes, and they've had limited follow-up. So there's definitely room for improvement in that area. There can be much more research done on this topic. So in conclusion, we compared addiction and to alcohol as we compared it to a thief that comes to steal and kill and destroy, because that's really what it does. So we thought that the verse John 10:10 was especially appropriate. The thief comes only to steal and kill and destroy. I came that they may have life and have it abundantly. Thank you for listening to our presentation.